Hi everyone, this is Carolyn Waygood, board certified doctor of naturopathy and EMRO Quantum founding member. And one of the greatest joys that I have in being part of the EMRO Quantum family is the ability to introduce others to energy medicine as well as the EMRO Quantum business opportunity. This gives people an opportunity to get involved in the ground floor of what I truly believe is a historical moment in healthcare, a historical moment in medicine, and the future of medicine. And one of those people that I've been blessed to recently introduce EMRO to is Professor Dave Spencer. And I would like you to listen to this video where Dave addresses his passion for energy medicine, his interest in EMRO Quantum, and his ideas about the future of energy medicine. So enjoy. Dave, I'd like to introduce you to the EMRO Quantum family. Tell us a little bit about your background, Professor Spencer.
Well, my background is in health services management or health services administration. Basically, I have been in leadership roles in healthcare provider organizations most of my life. A couple of highlights: I was the CEO of a hospital management company that managed about 139 hospitals in 29 states, and did that for several years, and separately served as the chief operating officer of the University of Florida teaching hospitals at another time. Also, I have had for my own company in which we developed a system for helping prevent medical errors in hospitals. And this was a kind of personal passion on my part because my wife became injured in a procedure, and I made the decision that I was going to get some answers to it. So we developed a software system to help caregivers track and understand medical injuries. So those are the primary things I've done. I'm now on the faculty teaching health services administration and have been able to share those experiences with the students.
That's so valuable, and the gifts that you're giving out are so valuable in the future of healthcare. What has, obviously with your extensive experience in traditional medicine, what has drawn you to energy medicine and EMRO Quantum?
Well, a number of things that I think are critically important to the future of our healthcare industry. So I see this as an enormously, potentially important development in the entire healthcare industry. And if you have worked, as I have for 40 years with physicians and others, you realize there is an enormous resistance to change in traditional medicine today. Medicine is very slow to change, and at the genesis of that has to be changes in the medical school curriculum, which doesn't happen very often, and it's a very, very slow process. I see energy medicine as another solution to many of our current diseases. And in that process, I think we can see ways to solve some of the problems with our healthcare industry. So if I were to kind of be more specific about that, I've been dealing for many years with the problems in our healthcare system. And there are three core problems. One of them is cost of care. People can't afford to pay for their care, and you see that fight going on right now in Congress. Are we going to provide coverage for everyone or just a few of the more privileged? But costs are huge, and they're going up, and they're becoming more of a barrier. The second thing is quality. There are a lot of problems with quality in maintaining health care. One of them is that many of the treatment modalities are very invasive. And anytime you've got invasive modalities, you have risks of education and inflammation. You have all kinds of problems with communicable diseases, and you have slow healing. I've been impressed with the concept of energy medicine and the many, many things that can be done to help human healing that's totally non-invasive. And that's the second thing. And the third thing, which is connected to these two, is access. how do people get access to care? It's really easy in our country to get sick, then to get sicker, then to not have access to insurance, then to get sicker, end up in an emergency room with a bill 5 times as much as it should have been. The problem that I see with energy medicine's opportunity is to avoid a lot of that access. We have backlogs of people in areas of care where they just can't get to see a doctor. And if you can't get to see a doctor, you can't get better in our traditional system. This opens a whole new avenue to accessing care in a way that people who don't have to be rich to be cared for. So those are the things that to me are very exciting about it. And I have a background earlier in pre-medicine and took a lot of courses in physiology and chemistry and things like that. So I don't look at this as all that outlandish. I think the whole idea of vibration as a way of treating a disease makes a lot of sense to me.
That's so beautiful. I love the 3 points that you make about what establishes energy medicine as the medicine of the future, and the fact that it is accessible, it is cost effective, and it's non-invasive. Those are 3 points that everybody has to realize and embrace. So you got involved in EMRO Quantum recently. You became an EMRO Quantum retailer. And why did you decide necessarily to choose EMRO Quantum as your next business endeavor?
Well, I got introduced to a professional named Dr. Carolyn Waygood, and she introduced me to quantum. I have had an interest in this area, just intellectually, for many years, and had followed many ideas about energy in the human body with Dr. Wayne Dyer and other people, and have always felt that this was an avenue to provide care. The thing I think it's important here is that I believe the way you're approaching the problem with the retailers and the way you're approaching getting it into the field, there is the potential to get this out there very, very quickly to a lot of people that otherwise we wouldn't be able to get it out to. There is a science, or there is science, behind all of this. And I have always been attracted to innovations in healthcare, because I believe innovation is the key to making our system better. In energy medicine, we will see an explosion of science. The way it will start is there will be some of us who come out there and say, hey, we have observed this, therefore it's a fact, and we're going to do something about it. There will be people that come after us that say, no, we got to do a lot of research on this. We got to do double-blind studies, and we have to have it published, and it all has to be peer-reviewed and all that stuff. And that's all true, but that's not where innovation starts. Innovation starts with people who believe in an idea, who are willing to make a commitment to that idea and make it work. And I'm just impressed with the people that I've talked with in Quantum, that this is the right team to do this. And this will be a team endeavor, because there's not a role model for doing this. This will have to be invented as we go.
Exactly, and I think EMRO Quantum is positioned uniquely in the industry to have their hands untied and to have a clean slate and to push this forward without those, for lack of a better term, traditional handcuffs. And so it is an exciting time to be involved in EMRO Quantum, definitely.
Well, I think that's an important part of the whole idea, and that is that this can be developed independently of the path that traditional medicine is on. I think it has the potential in the long run of being in an entirely separate segment of our healthcare delivery system. I think it will do more than have a few interesting treatment therapies, which you have today. I think it will offer alternatives to traditional ways of treating disease. For example, if you were able to give me a series of treatments with a disc or a patch or other way to deliver energy medicine, if you gave that to me and I had a tremendously painful knee that I could no longer walk on, and you could help with that, healing it with energy medicine, it would beat the heck out of a knee transplant.
Yeah.
And I think there will be a lot of that. I think as it evolves, people will see there are optional ways to treat some pretty serious diseases. And so I just think I think it has a huge future. And some of the things that we do won't work. That's the nature of a startup, you know. But a lot of the things we do will work. And I just think it's an exciting opportunity. And in addition to that, I'm excited about the idea of working with Dr. Waygood and the knowledge she has.
Oh, thank you so much, Dave. Thank you for your time and your expertise, and everyone at EMRO Quantum looks forward to working with you as well.
Thank you. I enjoyed it.
With Dave's extensive experience in the healthcare industry, as well as his passion for education and teaching, he is going to be a valuable addition to the EMRO Quantum family. And one of the quotes that resonates with me from his interview is the one where he says, "Innovation starts with people who believe in an idea, who are willing to make a commitment to that idea and make it work." And that summarizes the excitement and the passion that exists within the EMRO Quantum retailer family and our pursuit to push energy medicine into the future for the benefit of all. So thank you so much, Professor Dave Spencer, for joining us in this important and historical journey. I look forward to working with you.